Hi, my name is Wendy Myers, and I'm a health and nutrition coach. Today, I want to talk to you a little bit about atherosclerosis or hardening of the arteries. It's a subject that's very close to my heart because my father ultimately is one of the conditions that he passed away from, including esophageal cancer. And so it's something that I wanted to inform people about because I don't want you to have to end up like him and taking all kinds of toxic medications that ultimately do nothing to address the cause of your heart condition and actually make you sicker. Now, one of the how atherosclerosis starts is you basically do a number of things like you smoke, you have high cholesterol or high triglycerides, you're sedentary, you have high blood pressure, or you have insulin resistance, or prediabetes or diabetes. You're overweight, or you've used too many estrogenic type of medications like birth control pills or hormone replacement therapy. Also, sleep apnea, stress, or excessive consumption of alcohol all can cause plaque to build up in your arteries and cause them to harden. Another cause of atherosclerosis is zinc deficiency and some other deficiencies that cause your body to deposit calcium and other things in your arteries to harden them. It's kind of like when you have a zinc deficiency, it weakens the arterial walls. Also, when you have cadmium toxicity, this also weakens your arterial walls and it causes your body to calcify the arteries and harden them. So you want to get rid of all the things in your body, all the toxins that would be possibly causing your arteries to harden and are causing cholesterol to oxidize and be deposited in your tissues, or that interfere with cholesterol metabolism, which I will tell you about in a minute. Now, the conventional treatment for atherosclerosis is angioplasty. My father had an angioplasty. It's where they place a stent inside the artery that's blocked, and it presumably opens up the blockage, opens up the artery, allowing blood to flow through it. And this is supposed to, prevent you from having a heart attack or suffer chest pain and whatnot. However, studies show that 8 out of 10 people that have an angioplasty procedure are not good candidates for it and would be better served by having less invasive, like lower invasive treatments. And also within a few months, many people experience a reblockage of the same area where they had the stent. For whatever reason, they know the stent obviously can cause some injury to the area and can cause a blood clot to form and cause another plaque to form, which defeats the whole purpose. So what doctors typically do is they put you on warfarin or Coumadin, which will thin your blood and presumably prevent this complication from happening. But warfarin is actually also used as a rat poison. So that doesn't really make a whole lot of sense to me to put a rat poison in your body to help your health. So I definitely advise against that. I'm going to tell you a little bit about some natural lifestyle measures that you can take in a second. Another thing that people do is bypass surgery. This I definitely do not recommend. There's actually some other things that you can do. The bypass surgery takes veins out of your leg and replaces them with the blocked arteries in your heart. And this sounds great, but my grandfather and my great uncle both had this procedure done, and they did not take very good care of themselves. They smoked and ate horribly and didn't exercise. Um, so they had this procedure done, and they never actually recovered. I think afterwards it just took months and months and months. And granted, they had it done a while ago, decades ago, but they had it done, and they both just felt like they never actually recovered and were on a slow, steady decline following the surgery. And so there are other things that you can do, namely lifestyle measures and other natural treatments. And I definitely, that's just last resort. I beg you, just absolutely last resort after you've just tried everything else. But if you're not willing to change your diet and lifestyle, you may have to undergo this procedure to save your life. One of the next things that a lot of physicians do is they prescribe aspirin to their patients to presumably thin their blood. I definitely recommend you even potentially finding a different doctor if they prescribe this, because it was proven 2 decades ago that aspirin does not help in any way to prevent heart disease or strokes. It actually contributes, actually doubles your risk of stroke, and it contributes to age-related macular degeneration, which is the #1 cause of blindness in seniors. So if you're having eye problems or anything else, look at the aspirin as the cause of that. Aspirin is one of the reasons that aspirin has become so popular is because 2 or 3 decades ago there was um, a, a study done funded by Bayer, one of the makers of aspirin, and this study found that aspirin definitely helped heart patients. It helped to prevent the heart attacks. One thing they kind of left out is that a lot of doctors are not clued into is the fact that the form of aspirin that they used was the bufferin aspirin. It was called bufferin, and that contains magnesium oxide. So the magnesium was actually what improved their heart health and prevented them from having heart attacks, not the actual aspirin. So that was a little confounding variable in there that screwed up the results of that study. So just take magnesium. That's what you need. You have thousands, millions of magnesium receptors in your heart, and you need magnesium for your heart muscle to work properly. And many people, because of their diets and because of other mineral deficiencies, they just don't have enough magnesium. If you eat tons of sugar or eat tons of grains, grains and sugar deplete magnesium. So just supplement with a chelated magnesium. Another problem that doctors do is they advise their patients to go on a low-fat, low-cholesterol diet. This is the conventional prescription. I definitely advise against this because it doesn't make a whole lot of sense. Um, by eating a low cholesterol diet, you're cutting out a lot of very healthy foods that you need. You need to eat red meat occasionally for the iron and for the vitamin B12 and zinc. You need to eat eggs. Eggs are incredibly nutritious and have to contain tons of healthy fats, omega-3s, that you need for heart health. It's total fallacy that eggs are bad for you or bad for your heart. The problem is it's not that simple. You don't just eat dietary cholesterol and all of a sudden it's floating around your veins. The body does not work that way. What happens is actually when you eat grains and sugar and refined grains and flour, those things actually cut the insides of your veins and damage them. The high blood sugar that they produce damages your veins, and that is what causes cholesterol to come in, your liver to produce cholesterol, and come and repair that damage. And that's what causes hardening of the arteries and high blood sugar as well. As you know, heart disease and diabetes correlate. People that have one usually have the other, and it's because of refined grains, sugar, and flour. So those are the things that you need that's a low cholesterol diet. That's what you need to be aware of. Because no matter how much dietary cholesterol that you eat, 80% of your cholesterol that is in your body is produced by your liver. So it really doesn't matter how much cholesterol intake you have in your food. So don't take that prescription from your doctor. Don't take that advice from your doctor. Take my advice. I want to tell you a little bit about some lifestyle measurements that you can take to improve your heart health and improve atherosclerosis. One of them obviously is exercise. You need to get a little bit of exercise on a daily basis, even if it's only for 5 minutes. You definitely want to quit smoking. Smoking oxidizes cholesterol. It's not cholesterol per se that's the problem in your body, it's oxidized cholesterol. And cholesterol oxidizes when you smoke, when you drink alcohol, when you're sedentary, because exercising produces antioxidants that prevent oxidation of cholesterol. Drugs and other things oxidize cholesterol. So just generally you want to have a healthy lifestyle to prevent this oxidation of the cholesterol. You want to make sure you control your blood pressure. I advise you doing this through natural means, not through medication. And to learn how to do that, I recommend a wonderful book called The Blood Pressure Hoax by Sherry Rogers, MD. Fantastic book, tell you everything you need to know. Another thing you want to do is control your cholesterol intake, or your cholesterol levels rather. I definitely don't recommend ever taking statins. That is not the proper way to control your cholesterol, because what statins do is basically poison your entire body. They poison the mechanism that in your liver that where it produces cholesterol. And cholesterol is an incredibly protective, necessary material we have in our body. Our every cell membrane of our brain, of our body, everything has cholesterol in it, every cell membrane. Our brain is 25% cholesterol, and so you need cholesterol to be healthy. So when you take a statin medication, like Crestor or Lipitor, you are in essence promoting your heart disease. You're going to further along the damage that's being done to your blood vessel, your circulatory system, and your heart, and it's actually going to cause more heart disease in the long run. And the reason this is because when you have the high blood sugar from eating the grains and sugar and flour, you're cutting and injuring the insides of your veins, and you need that cholesterol to go in there and repair it. And unfortunately, you have to take away the cause of that, not take away the protective mechanism, which is cholesterol. So it just doesn't really make a whole lot of sense to do that. So I definitely advise you to never take statins. Go right now and throw them in the toilet, or not, don't flush them in the toilet, but throw them in the trash. And if you're not willing to take certain diet and lifestyle measurements, you may very well have to continue on the statins, or if you just genetically or for whatever reason, just no matter what you do, you just have a sky high cholesterol level, you may in fact have to keep taking them. So definitely try as many natural measures as you can to get your cholesterol down. Um, One of the next things obviously you have to do is control your diabetes. Like I said, diabetes and atherosclerosis, hardening of the arteries, goes hand in hand. It's because of the blood sugar issue, the blood sugar that's damaging the insides of your circulatory system. So again, that is remedied by the same exact thing, cutting out grains, even if they're whole grains like brown rice and whatnot. You want to cut out all the grains, all the flour, and all the sugar. And that's going to take care of the diabetes and the atherosclerosis for you. Also, surprisingly, you want to make sure you maintain your dental health, because studies show that 70%, if you don't take care of your teeth by brushing and flossing and getting your teeth cleaned at your dentist, those people are 70% more likely to get heart disease. Because all that bacteria in your mouth very easily, if it builds up to toxic levels, very easily gets into your bloodstream and can get inside your veins and go to your heart, and actually can, I knew someone that they had some dental work done, and the toxic bacteria they had in their mouth, because they never had their teeth cleaned, got onto their heart valve, destroyed it, the bacteria, and they had to have a heart valve replacement at 25 years old. So this bacteria is very deadly, and you need to definitely address any periodontal disease that you have. And it's very simple. Brush your teeth twice a day, floss your teeth, and get your teeth cleaned out of the dentist twice a year. That's an absolute must. Some of the other things you can do for alternative treatments, some things that are very interesting. You can get a natural bypass surgery. It's called enhanced external counterpulsation. This is something that increases collateral circulation and collateral growth of blood vessels around the damaged ones. So basically what they do, it's a treatment every day for 30 to 45 days. It's a little mechanism that you get into, and it just increases your circulation throughout your body and promotes the growth of new blood vessels that can bypass the old ones. It's great, and the majority of people that undergo this do not end up having to have bypass surgery. So there's other ways out there, most of which you're not going to hear from your regular cardiologist. Another thing that you can do is it's oxygen. It's a hyperbaric oxygen chamber. This forces oxygen into your tissues and detoxifies them. Because oxygen is an antioxidant. It kills bacteria, and it can help your body get rid of toxins. It's very, very effective. Another thing that you can do, I highly recommend, it's a program that I do. It's called Nutritional Balancing with Hair Mineral Analysis. Many people that have heart disease and other chronic diseases simply have mineral deficiencies. And they also, their body is full of toxins, of phthalates, industrial chemicals, and toxic heavy metals. So, what this wonderful program does is they just take a sample of your hair. It's very simple. They test it, and you see what mineral deficiencies you have and what toxic heavy metals you have that are your body's dumping in your hair. And then you just go on a targeted mineral supplementation program that really takes about at least a year to get these minerals into your body and get sufficient mineral levels. And it just strengthens your entire body. It strengthens your immune system, and you have to have these minerals for your body to function and be healthy. And the majority of people today are just, they're deficient in minerals because our soils are so depleted and our diets are so terrible. And it just is really a big problem. So it's really important. And you can't just take a Centrum one a day mineral. Minerals are really bulky. So you end up having to take a number of minerals 3 times a day with each meal. It's kind of does take a little bit of work. It's annoying. Sometimes I don't feel like taking my pills, but I want to be healthy more than I don't want to take my supplements. Again, it's about targeted supplemental minerals, and they also provide detox strategies to help your body push out all these toxins that are like cadmium that prevents your weakens your arterial walls, and zinc deficiency, and mercury toxicity, and lead toxicity, and all these things that are causing problems in your body. It's fantastic. Some of the other things that you want to be doing are an infrared sauna. Infrared saunas are imperative to getting rid of phthalates in your body. These are plastic hardeners. They're one of the main things that people's bodies are very toxic with, and they prevent your body from metabolizing cholesterol properly. So when you sit in an infrared sauna, you can sit in one every day or every other day for about a year, and you'll be able to just get rid of all of these phthalates. They're kind of like these plastics that just gum up, they get inside your body and your tissues, and they just gum everything up. So everything just can't work properly. And I'm not even talking about the other 100,000 industrial chemicals that are in our environment that you're going to be able to purge because of doing an infrared sauna. It's fantastic. You can build one at home for $200 to $500, and I have a blog on my website about infrared saunas and where you can purchase one. You can also go if you live in a large metropolitan area, you can go to an infrared sauna. There's a lot of spas and treatment centers have them. One of the other things that you can do as far as taking supplements, absolutely fish oil. Fish oil is absolutely proven to reduce high cholesterol and improve heart health. Another major one is coenzyme Q10. That will definitely strengthens the heart muscles. And unfortunately, if you take statins, how the statins poison the pathway in the liver that produces cholesterol. It also poisons the pathway that produces coenzyme Q10. And this is another reason if you take statins, you're going to be on a slow, steady decline in your heart and general health, because you absolutely have to have coenzyme Q10 for your heart muscle to even work. And it also is a very, very powerful antioxidant in your body. So you definitely, if you have any heart problems, you want to supplement with coenzyme Q10. Another one you want to use is niacin. Niacin is absolutely shown to reverse blockages in the artery. It's wonderful. Like I said before, magnesium, absolutely necessary if you have a heart problem, especially if you're on magnesium depleting heart medications. You gotta take magnesium. L-arginine is another one that produces, it's a just simple amino acid. It's very cheap, and it's naturally occurring in foods, but it's a good idea to supplement if you have a heart disease. And L-arginine strengthens the blood vessels. I think it's fantastic. Some of the foods that you want to take that you want to use to increase your heart health are fish. For the omega-3s, I suggest small fish, like small non-predatory fish. because they're going to have less mercury and other pollutants in them. I regularly eat sardines and anchovies, herring, sole, what else? Other things like salmon's really good with the larger fish. Salmon's really healthy for omega-3. It's not too many toxins. The number one thing you got to do is not eat trans fats. You, as a heart, if you have a heart condition, you cannot eat anything with interestified fats or partially hydrogenated fats. The reason being is because if trans fats were taken out of our diet completely, they were taken out of all the packaged foods and all the fast food, which pretty much 100% of fast food contains trans fats, and the majority of boxed food contains trans fats. If this was removed from our food supply, heart disease would be cut in half by 50%. That is how problematic this food is to your heart health. Additionally, you can't eat any fried foods. All fried foods, including French fries, contain trans fats. Just what happens when you heat up oil over and over and over to a high temperature, it turns it into trans fats. So you can't eat fried foods. You also cannot eat any kind of vegetable oil except for olive oil. Because vegetable oils, why they sound like they're healthy, they're not. They're very, very inflammatory. And so inflammation is the underlying cause of heart disease and atherosclerosis. So you have got to cut those out of your diet, like I said, except for olive oil. You want to eat flaxseed. Flaxseed is wonderful. Anyone who with atherosclerosis should be eating, take a couple tablespoons of flax seeds, grind them up fresh, and put them in some water and drink them once a day. Have it like 30 minutes before your main meal. And that fiber, what it does is it has omega-3s, which is wonderful, but the fiber gets into your intestines and it prevents the reabsorption of cholesterol back into your body. So this is a wonderful, it's like a natural statin. You don't have to take statins. There are so many things you can do to prevent cholesterol from getting into your body. Another thing you have to do is you have to avoid wheat. You have to avoid any wheat kind of flour. These, not only do they contain gluten, but because even if it's whole wheat or whole grains, you have to cut it out because it breaks down into sugar in your body. The whole grains break down slower, but they still break down into sugar nonetheless and cause that damage and injury in your blood vessels, and then cause the arterial hardening and plaques to form. Additionally, you have to cut out sugar. Like it does the same thing. It doesn't matter what kind of sugar it is, agave, maple syrup, brown rice syrup, it doesn't matter. It's all sugar. You got to cut it out. You're just going to have to learn to live with it. And that's just the prescription for health in general. So these are the things that I recommend to do, and I hope these can prevent you from being in any further pain and enable you to reverse your condition, because you can absolutely reverse heart disease. So thank you for listening, and you can read more on my blog on liveto110.com.